Hi, my name is Erin Chartier, and for my medical disease presentation, I did Necrotizing Enterocolitis, or NEC. So the breakdown of the words necrotizing enterocolitis, necro is the prefix in the word necrotizing, and that means dying or death. Another common word that you'll see throughout the medical field is necrosis, and it literally just translates to death. O is the combining form in this word, and then tizing means process of. So necrotizing means process of dying. Enterocolitis, enter means intestine or intestinal functions. O again is the combining form here. And then col refers to the colon and the colon's functions. So enter and col are often used together because they talk about similar parts of the body. And then itis we've seen 100 times before, that means inflammation. So enterocolitis is like the inflammation of the intestines and the colon. So the real definition of necrotizing enterocolitis is an inflammatory infection of the intestines and digestive system where the tissues will start to die. This primarily affects premature babies where the tissue becomes inflamed and dies. Like I said, this affects primarily premature babies. And their digestive systems are too compromised to fight off the bacterial infection. But there is no cause, no objective cause for NEC. Medical professionals have theorized about it, and they've kind of just come down to lack of oxygen in intestinal tissues or compromised immune system that would contribute to the bacterial growth in the intestines, as well as a diminished blood flow while the baby is still in the womb. Like I said, these things are just theories because that's what's caused other intestinal issues in adults and other children. But because of this, it has been proven that premature babies, really small babies, and then immunocompromised infants are susceptible to NEC and need to be treated properly. Some signs and symptoms. The signs in this case are way easier to detect than the symptoms because obviously an infant can't really tell a doctor how they're feeling, especially if they're premature. So some signs that a doctor would notice are a swollen belly area. That is probably the most common, and that's one of the first telltale signs of NEC, as well as the baby might experience tachycardia or bradycardia, especially if premature, as well as changes in blood pressure. Another aspect that's very evident in diagnosing is green-colored stomach acid, which is often seen in their vomit, as well as a bloody stool, and a lot of babies will be severely jaundiced prior to their diagnosis. Some of the symptoms that you might see are abdominal pain. The infant could cry because their stomach hurts. A lot of the time the baby will refuse to take liquids and refuse to eat. They'll be lethargic or irritable, and then along with their changes in heart rate and blood pressure, slower, rapid breathing. Some of the visual signs of NEC, as you can see in the top left corner, there's a healthy piece of the large intestine, and then as you go down you can see the necrotizing tissues. In the lower left picture, you can see the baby has a very swollen stomach, and that's probably the most common telltale of this condition. To the right, there are a series of x-rays that show the obstruction and the inflammation within the stomach. And then in the lower right corner, you can see a severely jaundiced baby with a swollen stomach. So those are some of the things the doctors will be able to diagnose this condition easily. So the diagnosis, like you saw on the last slide, NEC can be diagnosed through abdominal x-rays. The doctors will usually perform those alongside some blood tests if the x-rays are not totally conclusive. There are fecal tests that can be made so that you can test the blood count or other symptoms, and you can test for other infections within the digestive tracts. And then a doctor will often use x-rays and blood tests as well as a paracentesis or an abdominal tap in order to diagnose this, but the most common way and the easiest way is through x-rays. So for treatment, NEC is not extremely fatal. It is if it goes untreated, so it poses great risk for other abdominal issues especially. So some of the treatments that the doctors will do are an NG tube or nasogastric tube that goes through the nose or the mouth, and then it'll suction the fluid and hopefully the bacteria out of the stomach. Along with that, babies with NEC will often be put on a series of antibiotics, usually that are given through IV, and that'll help knock out the infection and hopefully repair some of those tissues. Surgery is probably the most drastic measure, and most babies don't need it because the antibiotics and the NG tube will work to knock out the infection. 1 in 4 will need surgery, but those aren't like crazy surgeries. A lot of time it'll just be an ostomy or a drainage where the doctor will repair and remove the necrotizing tissue. They'll take the dead inflamed tissue and they'll remove it and then help repair the intestines. Long term, the infant shouldn't need much treatment unless obviously they've had surgery, then they'll need time for recovery. But a lot of the time they'll just need to be monitored over several months after the infection is cleared up. The trajectory of NEC, usually it's very important to catch it early and then treat it as soon as possible. After the treatment's been administered, the infection will usually clear up within 1 to 3 weeks, depending on how severe the infection is. When surgery is performed, obviously the infant will take a little bit longer to fully recover. However, there is an 80% survival rate, so if caught early and treated properly, children with necrotizing enterocolitis will survive and live problem-free lives. Most infants will recover and live without any stomach issues. In some cases, they'll grow up with nutritional issues, and some will have psychological issues. So there have been children that have NEC as little babies, and then they grow up and they have eating disorders because there's some neurological trauma in there. However, that's uncommon because most babies will fully recover quickly, and then they will live problem-free lives. And those are my sources. Thank you.